What exactly is he looking for? Was this like a blind arranged marriage? Did they first meet at the wedding or something? She may be dying. If she is bleeding internally, she needs to be rushed to the OR. What is happening? Hey guys, welcome back. I'm Jess the MD. Thank you so much for joining me. We're gonna be watching a clip from the show House and reacting to it. Let's jump right in. It's a Jewish wedding. Where is she bleeding from and why?
MRI shows no sign of clots. fMRI shows no problem areas.
They'll restart her IV.
What's wrong with it?
Nothing. But like so many procedures we put patients through, it hurts. But if she's enjoying it, will show up in pretty colors.
This is why you wanted an fMRI?
It showed she didn't have a blood clot, which is diagnostically relevant. And it can show that she's become a masochist, also diagnostically relevant. And it'll be cool.
Clearly, we're just watching a clip because I have zero context, but first of all, it seems like he's doing a functional MRI for no real reason, and insurance won't really cover that. But second of all, what exactly is he looking for?
Sorry.
Heavens. Look at her limbic system. Pleasure centers are lighting up like a Hanukkah bush. Foreman must have a touch like an elephant.
Interesting. So he's just touching her on the hand, it looked like, and the pleasure center of the brain, the limbic system, is being activated. I wonder why.
Roz, you all right?
Sorry, I was praying.
All through the procedure?
No, when Dr. Foreman apologized, I knew something bad was going to happen.
She was praying. Could explain the brain activity.
BP and heart rate are dropping. She's crashing.
To some degree, that can be orthostatic hypotension, meaning she got up quite quickly and her blood pressure dropped. Usually you would expect the heart rate to go up, so if her heart rate was going down, yeah, she could have been going into cardiac arrest. Unclear reason why.
She's stabilizing.
Get her up. All the way up, on her feet.
So the other thing that I'm thinking of is this POTS. POTS is a form of dysautonomia, and it's essentially a blood circulation disorder where your heart rate actually goes up really, really high when you move from laying down to sitting to standing, and people can feel pretty faint or dizzy when that happens. In this particular situation, it looks like this patient's heart rate is going down every time she stands up. So I really wonder what's going on there.
That cortisol stuff is great. Does it work on everything?
I take it you're feeling better.
Oh, still weak, but yeah.
Your abdomen's a little swollen.
Is it serious?
It's hard to say. Sometimes it can mean a liver issue. We'll have to test.
Oh, dizziness is getting...
She's going to shock and need another liter of saline. Type and cross 2 units.
What's happening to her?
She's bleeding internally.
She's saying the Shema. She thinks she's dying.
She may be dying if she's bleeding internally like that and has been bleeding internally for a while. You can lose almost your entire blood volume in your abdomen. That could have been the reason why she was having such dramatic responses to standing up. If she was actually having a full body MRI like it appeared to be, I would have expected that to be caught a little bit earlier than now when they're doing an abdominal exam in the hospital room.
The MRI shows you're bleeding internally, but not where it's coming from. The blood can only keep you stable for so long. Our best option is to open you up and search.
When they say open her up and search, that means they're going to do an exploratory laparotomy. Basically, they're just going to cut from sternum all the way down to pelvis, open up her abdomen, and look around and see literally where they can visually see the bleeding coming from.
You find the bleeding, you find the disease?
No. But it could keep you alive long enough so Dr. House can find what's wrong with you.
Volvulus of the small intestine could cause bleeding.
She would have had constipation. Her value isn't beyond pearls either. Dead people have no value.
Polycythemia vera.
RBC count will be higher.
I need to bring the light to my face.
Why are they waiting so long to take her into surgery? If she is bleeding internally, she needs to be rushed to the OR. What is happening?
Thrombocytopenia. If it's autoimmune,
Titers were normal.
Parkinson's would explain the hypothermia.
Not the bloody urine.
She's wrong, but if there's nothing more.
Then the only meaning is here.
But if she thinks God is there for her, if she lives her life believing that God is there,
She dies. Things aren't where we want them to be just because we want them to be there. Of course, that doesn't mean they're where they should be. Hey! Stop that Jew!
What in the world does he think he's found? I think they intentionally make this show very confusing, even for healthcare workers, because I honestly have absolutely no idea what's going on or what Dr. House has figured out.
Stand her up.
She doesn't do so well on her feet.
Neither do I. Stand her up. You can tell all the ladies at the mikvah about this.
What did you do?
What are you doing?
Put your hand here. Press hard.
He seems to be moving some organ back into place. I'm not sure which, so I guess we should continue watching to figure that one out.
You have nephroptosis, also known as floating kidney. The kidney is like a chandelier. It's attached to a ceiling of intestines and blood vessels. It's your contractor. I think you know who he is. He hung it with a cheap chain. It's been hanging sloppy for years. Finally, something shook it loose. After that, every time you stood, your kidney dropped a few centimeters. Caused all your symptoms. Ultrasound to confirm, and tell Chase to put the kidney back on the shelf. The bleed will be nearby.
So this condition is called nephrolitosis, not nephroptosis. The P is actually silent. Ptosis is actually when something in the body is drooping. So you can have eyelid ptosis or breast ptosis. And in this case, it sounds like her kidney is drooping. So basically what it is there's a deficiency of the connective tissue that's holding the kidney in place. And when something shook her kidney loose, that's when the symptoms actually fully started to appear. There's always randomly interesting diagnoses that House comes up with. The treatment for this in particular would be a nephropexy, meaning adhering the kidney to something like the abdominal wall.
That's it.
Muzzle tough. Couple hours surgery, you'll be ready to push out those 14 children.
Well then, House found yet another random diagnosis that most of us may have encountered once in medical school, but House remembers it all because he's amazing. If you enjoyed this episode, like down below, subscribe to the channel. It really helps me out. Thank you so much for joining me. I hope you enjoyed spending time with me. I really enjoyed spending time with you. I'm jessthemd, and I will see you in the next one. Bye.